Thank you. Thanks for inviting us to come back again. Myself, Allyson, Angus, Public Involvement Manager, very keen in the e-participation agenda, and I've got Laura Nixon with me today, who's our expert on moving forward with the whole participation online agenda. I'm going to share with you a photograph there, and I wonder if it may look familiar. That's Andrew, one of our public partners. And there's Andrew standing there with the clipboard, the pen, the questionnaire. He wants to ask some questions. What I think I'd like to do is to talk about the innovative ways to engage, but Gary alluded to we mustn't lose sight of what we already do. So this is just to flag up, let's not forget about the traditional ways, but let's start looking at the innovative ways to engage, and indeed we've looked at some already today. It's doing it without paper, not forgetting that we need to use paper, but looking at going on without having to use questionnaires all the time. Early research. We went out and about and we did some research. We engaged with lots of people about whether or not they would be interested in the online methods for engaging with people. And it was quite clear from that early start that there was a clear public interest in what we were suggesting. So that gave us the encouragement to move on. The next good thing that happened was that we got some innovation funding from the Scottish Government Health Department, so that helped us get cracking on with things. And part of that deal was to work with Scottish Health on the Web, SHOW, our IT specialists in the NHS. So things started to become a reality. It looked like we were going to have this tool that would help us to engage with people online. And before we could begin to really progress forward, we had some testing, test. If I heard Laura say test once, I've heard her say it 100 times, but she was absolutely right. That's what we needed to do. Once we got the testing done, then that was us good to go. And this is when I hand over to our expert Laura, who's going to take you through some of the workings of the website.
Okay, so I'm proud to announce that the e-participation website, Your NHS Tayside, went live last May to the public. And this website has been designed and created as a package of online tools that will help us to engage and involve patients, carers, families and the general public to get involved to help shape and improve their healthcare services. Now, we'll describe the different zones in more detail shortly, but with this website they can get involved online by taking part in quick polls, joining in discussions around various topics to debate and share viewpoints. They can also give feedback on NHS Tayside services that they've used recently, and also complete online surveys. Now, that picture just at the bottom there, this was taken during our roadshow events that we held when we launched this website last May. And that's just some of the promotional material that we had. And since May we've been testing various, still using that word testing by the way, still testing all the way, but we've been testing different marketing approaches to help drive people to our website and encourage people to get involved. And that last image here is an example of some of the online feedback that we're getting from patients who've used services recently. And this was just an example of a patient who was in hospital in the paediatric ward, and they just wanted to thank the staff for putting their daughter at ease and making a horrible day a lot easier. So now what I'm going to attempt to do is take you to the actual website, so just bear with me, and what I'm going to do is demonstrate how we've been, what the website can do, and also show you examples of how we've been using it. And I just want to add as well that since May we've been, looking at, okay, well, how does this work? What's working well? What doesn't work so well? We're testing different engagement activities all the time. So as the journey continues, we're always learning about this tool. So as I say, just bear with me. The joys of technology. Here we go. Oh. Okay, so this is the NHS Tayside website, and we have the different zones that the public can participate in. You can see here we've got a quick poll on the right hand side, and what we're doing just now is we're running a quick poll to coincide with a pilot that we're doing in Ninewells Hospital, where we are testing flexible visiting times. So we thought it would be a good opportunity to also pose the question online to find out where people in favour of flexible visiting times. You can see that we've also got our links to social media. We have NHS Tayside Facebook and Twitter pages, and we use these tools to promote our online engagement activities, again to get people coming onto our website. So I'm now going to just take you through each of the zones in a bit more detail. Now the first zone I'll take you to is the feedback zone. So when you click on the give feedback icon, it'll take you to the give feedback zone, and patients, relatives and carers can give their feedback on services that they've used recently by completing the feedback form. And it could be, sharing a suggestion on, what we could do better for next time. They might want to just say thank you, or they might want to raise a concern. And what will happen is they'll complete the feedback form, they can rate their experience, and once it's submitted, it'll come into the public involvement team, and we'll take the appropriate action and make sure that, it's passed on and acted upon. And we're currently undertaking a piece of work in NHS Tayside just now with some key staff to look at how we, manage and share and act on the feedback that we're receiving through our online mechanisms. Now this zone is being used regularly since we went live, and we're getting a lot of positive comments about, particularly around, the care and compassion of staff, and we're promoting it through. We've got little pocket cards. We're looking to put on patient appointment letters, the web address. We've also added it to coming into hospital patient leaflets. So just trying different things to get people to give their feedback online. And this page we're continuing to develop further. This is part of the give feedback zone, and what we're trying to do here is demonstrate to people how we're acting on their feedback, what improvements have we made as a result, how are we listening to patients. And as mentioned, that will continue to develop over time. Now the events section, what this enables us to do is promote any events or activities that patients and the public are encouraged to participate in. So this could be any consultation events, public meetings. We also use it to promote our board meetings that the public are invited to attend. We've also promoted our annual review last year. And this is just an example that we've got just on our website just now. And what you can do is provide the necessary information, the time, the date. You can also have the Google map so that people, can find the venue. And you can also add any supporting documents, which could be, an event programme, an event booking form, any useful information that you think for your event. I'm just going to jump back a few slides. also have the online discussion section, and what this is basically we trigger a discussion. We'll set a question that we want to get a quick response on, and what the public can do is come on and read what other people have said and then share their viewpoint, and so they'll be able to debate with others. And this is an example of one that we've triggered previously, and this was all around patient reminder services. And what we wanted to ask was, would patients feel it'd be useful to have a reminder service before attending for their outpatient appointment? So we asked if they felt it would be a good idea, and also how would they like to receive this reminder? Could it be a text message, an email, or a phone call? So people came on and added their comments, and what it allowed the lead officer to see quite quickly was the positive response to this idea, because what we do is encourage the lead officer to come online and read through the comments, and they can get a feel quite quickly as to, well, is this a good idea or not? So it's a very quick way to get patients' views on things. And this is just another example that we've been running recently around whether or not we should, when patients are discharged from hospital, the lead officer wanted to know whether it would be useful for the patient to have a list of their medication communicated to them at the time of discharge. So would that, could that be a paper copy? Would they like an email to them, or a text message? So again, we triggered the conversation, and there was a lot of positive feedback around, I would like, it would be useful to have a list of medication when they're on discharge. So again, that lets the lead officer, they're able to now progress with that particular piece of work. The consultation zone, unfortunately I can't show you the homepage, but when you come onto the homepage of the consultation section, you're able to see all the consultations that are open, and also any previous consultations that have been running. This is an example of a consultation that we're running just now, which is all around food and drink in hospitals. And we've got a survey that they can complete to tell us, what did they think, what was their mealtime experience like. With the consultation section, you also have the ability to add any associated documents. So again, you might want to add further information to give more of a background about, what it is you're consulting on. Perhaps you were doing an option appraisal exercise and you wanted to include the different options, so you can download that document and read it before you then submit your views. And this is just another example. We've been developing a new website for NHS Tayside, our corporate one. And again, we just encourage people to get involved online to give their views around how information should be structured on this new website. This consultation is now closed, and this is just an example. You can see down the bottom there's an outcome section, and so when a consultation is closed, we will make sure that the outcome is also displayed on the website, so that patients and the public can see how we've used their views, how we've acted upon them, what was the results. And it also makes sure, it helps us to ensure that we're in line with participation standards, making sure that we are providing feedback. And again, when a consultation is closed, you can add the final report, a summary of the outcome. And we also have the ability we can create surveys using the internal software that the website has, but we can also link to any external surveys. So this one, for example, was live on the website previously, and this was a national survey around the Patient Rights Scotland Act and the secondary legislation. So we were able to promote that website, that particular consultation as well. We also have quite a good relationship with our local authority, across Tayside. So, we also signpost to each other's consultations because there's a lot more joined working as well. So that's me just explain some of the. That's me just taking you through, a very kind of brief tour of the website. It's just unfortunate I couldn't let you see it on the internet. But we are around at lunchtime. We've got an iPad with us, so if you want to, come and see us, and we'll be able to give you a demonstration and discuss if you've got any more questions and things. And I'll just pass you back to Allyson.
I think there's a bit of a conspiracy going on here, because the last time we did this we lost the online connection, and I had to give Laura a pay rise for remembering to bring all the slides with her, so I think there's a wee bit of a wheeling and dealing going on here. Gary's bound to be in on it. Okay, just a couple of slides to close this off, and what I really want to highlight is this is a set of engagement tools. It's not one way, it's a whole package, and that's allowed us to interact with the different elements of it. There's no doubt there's enthusiasm from the services that we are working with to provide engagement activities. It's that innovative way of getting their message up and over and across to the public. Participants, we know by the speed of response that we've got the enthusiasm from the participants that are involved in this, and we've no doubt the added value on the impact to services, whether it's a quick poll or a longer discussion that goes on, and the speed of process is important around all of this. Reflections, there is resource required, money, I think Ros alluded to some of this not perhaps costing much, but development costs things, costs money. Skills are needed, skills in developing online material, and skills required in actually doing what Laura does in managing this. The requirement to test, we've talked about that, and that good old marriage between participation and technology has to be the way forward. And we're constantly forward planning, and that brings us to future plans, future-proofing the website. Things change daily, by the hour, and we have to be able to ensure that we capture what lies ahead of us. The technology advances, working with iPads, tablets, iPhones, things like that. The ongoing marketing exercises to do that all the time and not just on a one-off. Meeting the demands not only of the participants but of the organisation internally. Remembering to demonstrate the benefits of using this to all those involved, and then we can reap the rewards. I want to just capture something that Michael said, and that was, it's a machine that doesn't stop, how true he was in saying that, and Ros referred to immediate engagement and the need to take up pace, and I think this absolutely sums up what we've been trying to do here. And as Laura said, we'll be outside at lunchtime and you can see it for real. Okay, thank you.